Good evening, everybody. Welcome to the CHF Potential Candidate Information Webinar. I'm Tony Lawson. I'm Chair of Consumers Health Forum of Australia, otherwise known as CHF. I would like to acknowledge the traditional owners on whose lands we are meeting this evening and pay respect to their elders, past, present, and emerging. I am meeting on Kaurna land. The purpose tonight is to talk about attracting new candidates to the CHF board through a number of mechanisms, and we'll outline that as we go through. I'll start the process and then I'll hand over to Joe Watson, our Deputy Chair, and then I'll ask Elizabeth Deveny, our CEO, to give an overview of some of our current activities and achievements. So I'll start the ball rolling by asking the question, why be a director on the CHF board? Well, that's a great question. As most people would know, and I'm sure most people that are attending tonight would know, that the CHF is the national voice for health consumers. In 1988, when CHF was first established with government funding, the Honourable Neil Blewett, Minister for Community Services and Health, in a speech to CHF said, "Without informed, knowledgeable and articulate health consumers, health policy will always be unbalanced, whatever the goodwill and idealism of governments and health providers. Mature consumer organisations are an essential part of the health equation. As an independent, non-government organisation, CHF helps shape Australia's health system by representing and involving consumers in health policy and program development. CHF and its members reach a wide network and mix of Australian health consumers across an extensive range of health interests and health system experiences. Over the decades and still ongoing, CHF is recognised as the peak national consumer health organisation in Australia. This is recognised by the federal government through funding we receive through the Health Peak and Advisory Bodies Funding Program administered through the Department of Health and Aged Care. To further emphasise this, a members' feedback survey, which we undertook in March 22, provided strong endorsement from our members to the extent that 86% of respondents agreed that CHF is a leading consumer health organisation, and nearly 82% of respondents agreed that CHF is a thought leader in healthcare. Under our modern constitution, our board is constituted as a skills-based board, not a representative board, of up to 9 members. 6 directors are elected by the voting membership, and up to 3 are appointed by the CHF board on the basis of relevant skills which can contribute to the operations and high-level strategic decision-making to ensure the ongoing viability and credibility of the organisation. Accordingly, we have directors who are skilled in a broad range of areas, including, of course, consumer participation and engagement, health policy, health service management, health safety and quality, medicines policy, health technology assessment, Medicare, private health insurance, finance, law, general management, and governance. Following a term of 3 years, a director can stand for a second term election or be considered for reappointment for a second term, but can only serve 2 consecutive terms of 3 years in total, 6 years in all. All board directors are volunteers. We do not receive sitting fees, but we have all our expenses reimbursed. A small secretariat of around approximately 12 people, and this does grow or reduce depending on the projects that we're undertaking. They serve the board and organisation in various full and part-time roles. The secretariat team is led by the CEO, and all staff are on contracts usually attached to project funding, noting we try and ensure we have ongoing skills and expertise across policy, media, communications and membership activities embedded in the operational resources. Whilst the board reviews and approves the strategic plan and guiding policy, Day-to-day management of the organised affairs are delegated to the CEO, who in turn delegates to staff. In effect, the board has only one employee, the CEO, and the CEO is responsible for the staff. The board constantly reviews its effectiveness. E.g., we did have an appointed director who came out of the CHF Youth Network, and the board has been undergoing a rigorous succession planning process as we're all not getting younger and we need to refresh. We have 2 board committees, governance and finance, audit and risk management. Ad hoc committees are appointed from time to time to undertake specific short-term projects. The board elects the chair, deputy chair and chairs of the committees at the first board meeting after the AGM. Directors are appointed to each committee and directors are encouraged to be a member of at least one committee, and the chair of the board is ex officio on each committee. The board and committees meet up to 4 times a year, and since COVID, these have been a combination of face-to-face and virtual meetings. When circumstances permit, the board meets in at least one other capital city away from Canberra each year and holds a members forum, lunch and catch-up for members and stakeholders resident in that city. This provides members, stakeholders and directors the opportunity to meet and exchange views and raise key priority issues for CHF's consideration. The board, through the Governance Committee, regularly reviews its effectiveness and whether its composition has the correct blend of skills and experience to meet the needs of the organisation going forward. Results of the most recent stakeholder and member survey identified potential improvement could be made through board members having additional expertise and that a greater diversity of age, gender and cultural background was desirable. These results are used to plan for the next election and beyond, and we include a planned board refresh identifying potential new board appointed directors to fill the identified gaps over time, and that's the purpose of this evening. And our Deputy Chair, Joe Watson, will outline the process that we're going to be undertaking. As a CHF Director, you will have the opportunity to be part of a strategic, focused and collegiate board. This will include being involved in discussions on strategic priorities based on evidence collected from our various mechanisms and involvement in thought leadership, roundtables and webinars. From time to time, there may be opportunities to meet with the Minister and other health-related ministers, the Secretary and senior officials of the Department of Health, and with members, stakeholders and strategic partners. As the credible and recognised health consumer peak body, CHF has achieved a huge amount on behalf of our members and health consumers generally. Our CEO will provide an overview of recent achievements and projects being undertaken through the additional funds we received in the last federal budget. So, after 35 years of continuous operation, consumer participation is well recognised by many politicians, policy makers and service planners. And while considerable gains have been made in many areas for the benefit of health consumers, there is still a need for effective consumer participation and engagement, as it is still not universally accepted and there is still some tokenism, I'm unhappy to say. The challenge for CHF in the coming years is to maintain and enhance the recent gains made for consumers by articulating and contributing to effective consumer and community participation in healthcare policy and planning, service planning and delivery, and research and evaluation. To continue this important work, we need a strong board to set the strategic agenda and to continue to build effective partnerships across sectors. Our vision is for consumer voices to be strongly embedded in health and support systems that meet the needs of all Australians. Now, all financial body member organisations of CHF are entitled to nominate people to stand for election to the CHF board and to vote for board members. For CHF to continue as a successful and diverse organisation, we need new people to come forward to join our board now and over the next 2 to 3 years through our normal election process and through our appointed process. And I'd now like to call on our Deputy Chair and Chair of our Governance Committee, Jo Watson, to outline our plans to attract new board-appointed directors. Over to you, Jo.
So good evening, everyone, and I'm really happy to be here tonight. I'm going to take people through the election and appointment processes. And firstly, I'd just like to begin by acknowledging the traditional custodians of the land where I'm coming in from tonight. I'm up on the central coast of New South Wales in Darkingham country, and I wish to pay my respects to elders past, present and emerging. So I'm going to do a quick run through some of the more relevant aspects of the CHF Constitution because as a board of directors and charged with responsibility of looking after this great organisation, it's our source of truth. The 2024 board appointment process, which has just opened, and then what to look out for with the 2024 board election process. So we have a constitution that is very detailed in terms of understanding how CHF is regulated and governed. Our voting member organisations are essentially the critical governance authority of the organisation, and voting members are the only category of membership in CHF that have full vote rights in that aspect. I've also just made a note there to remind people that when you become a director of the board of CHF, you're also deemed to be a voting member as an individual director, and you hold that right for as long as you are a director. And that cedes when you have finished your term and departed from the board. So the voting members are the ones that are responsible for electing all directors to the board of CHF. But as Tony said, we have rules around the composition of the board in terms of not ever being allowed to get to less than 5 directors, but also no more than 9. We instituted several years ago term limits. Contemporary governance would suggest now that term limits ensure refresh and renewal for boards of organisations and also allow an opportunity to continue ensuring diversity and quality control. As Tony said, we're only enabled to serve 2 consecutive terms as a director on the CHF board now. And there is another clause that does allow directors to come back after a period of break, if you like, of that 3-year period in the event that anyone would want to come back and the membership or the board would deem that as appropriate at the time. The board appointment requirements, as the Constitution lays out, CHF has 3 director positions which are appointed by the CHF board itself. The Constitution then spells out what sort of skills and experience we look for those appointees. Now, the Constitution has a list, if you like, of some particular criteria speaking to qualifications or skills. But I've bolded there what I think is the flexibility and the discretion of any given board of CHF at any given time to consider what the requirements might be in terms of being fit for purpose for the necessary requirements at that point in time. So any qualification, skill or experience that the majority of the directors, or hopefully all of the directors, would agree is necessary for the good of the organisation in that process. At the bottom there, you'll see now that we also obviously have the requirements under either the Corporations Act or the National Charities Commission that talk about what is fit for purpose and required under law to be a director in Australia on any company board, and a board that is responsible for public confidence and trust. So currently, the call for expressions of interest from anyone interested in being considered by us to be a potential appointed director is now open. It's going to remain open until the 28th of May. I've put up there the link where you can get the information pack on the current process, as well as any of the documents that are relevant. The website's actually a really good place, though, as well, to find things like our full constitution, past annual reports and the like. We have one vacancy currently for an appointed director position, but by the end of this AGM in October this year, another appointed director vacancy will also occur. It's actually my position, and I'll be coming to the end of my two-term limit. The expression of interest application process is set out in that website area, but I'll just run through it now quickly. Have a think about the current CHF Board Director position description in terms of how it's captured in the document available at that link. Have a think about the commitment of time. As Tony said, it's a volunteer position. We have expectation that our directors will be able to attend either virtually or face-to-face the annual board meetings. There's around 5 at the moment that are scheduled, as well as subcommittee involvement. Some level of engagement with our subcommittees is considered to be a necessary requirement for our directors, and also other activities as required according to the pace and schedule and external focus of the directors on matters that are important and at the request of the CEO or others. Note the core skills and requirements section in that position description document. Not there to try and scare anyone off, but just to try and get a sense of what it is that is really central to understanding what I consider to be a really privileged responsibility, looking after the organisation, working with the CEO and by extension her team, and delivering on behalf of all of the membership and the expectations of that membership and consumer networks. If you want to give it a go, then there's the details in terms of providing the brief description of who you are and providing a current CV. Once the board process begins after the applications close on the 28th of May, there's going to be a check through the desk of the governance officer to make sure that everyone's applications are in order and fit all the requirements in terms of eligibility. The pack then is going to be referred up to the board meeting, which we've got scheduled currently on the 27th of June. And it's at that meeting that the board's going to consider those applications and provide advice and recommendations at that meeting. We want to move on this. We've got intensive succession planning in play, as Tony mentioned, and we're also very conscious of an election coming up as the normal part of the process for our annual general meeting later this year. So once the board's had those considerations finalised, we'll then be in touch with every applicant to let them know what are the outcomes, and we want to have that finalised by August of this year. If it's required to communicate with CHF members, if there are going to be any new board appointments at that point, then we'll be following up with that as well, post the August notifications to the applicants. In terms of board elections, the current requirements under the Constitution are set out very plainly. So the person is only eligible to be elected as a director of CHF if the nominee is endorsed and voted on by a voting member. Recently, we've changed the Constitution to try and simplify this process. In the past, a number of you may remember, the person had to be a member of a voting member organisation. And this was just not seen to be fit for purpose in today's very fluid arrangements with a number of our organisations, including our voting member organisations, who may have, for very strict reasons, a range of very specific requirements to become a member of their own organisation. So we felt that while that was presenting barriers and challenges to people, we wanted to try and reflect what is the balance of a voting member holding that power and authority, while also being able to endorse someone that they believe would be a suitable director for this organisation, but for whatever reason may not actually be a member of their organisation. This has been received well and was endorsed by the membership at a recent AGM. That change now allows a person endorsed by a voting member to be nominated up for consideration for a CHF board election. Once that is received by the board, the AGM packs are going to be organised. The nomination form will be inspected to make sure it's in order according to our constitutional requirements, and we go from there. The two current elected directors' terms ending this year are going to be ending at the AGM in October. So we're going to have an elected director nomination process commencing in September, and it will be run through the voting membership, as I've just outlined, run by a returning officer. If there are more than 2 nominations received for what will be 2 elected director vacancies, then an election will be required. And if that's the case, then it's going to be run for CHF voting members prior to our AGM and through an electronic ballot. Electronic ballot has been a process we've been using now for nearly a decade. The results of the election will then be confirmed by the returning officer and ratified at the AGM itself in October. So I'll leave it there, and enough time for people to think through all of that and any questions. But there's obviously Tony and myself if anyone wants to have a talk about anything. And that email is there if you'd like to contact us and don't have our details. Send that through to membership@chf.org.au and they'll be able to Tony or I to follow up with you. Thanks very much.
Thanks very much, Jo. I should have said at the beginning that we've got I think Elizabeth has outlined to people how to direct questions after our presentations. So please fire in the questions. I know there's a few there. I would now ask turn over to Elizabeth, who will provide an overview of current activities of the organisation and some of the things that are on our agenda now and into the little future. Thanks, Elizabeth. Over to you.
Thank you, Tony. I'd also like to acknowledge that I'm in Naarm, on the land of the Wurundjeri people of the Kulin Nation. I'd like to acknowledge their elders, both past and present, and their continuing relationship to the land and waterways where I am today. So from the operational perspective, As Tony indicated, we have a small staff team, less than 20 people, who work to deliver on the three kind of strategic goals of the organisation. These are consumers leading health. So we see the role of consumers in being able to talk to government and other organisations, clinical organisations, other stakeholders as critical. And our role is the conduit to help people be able to have those conversations and share their lived experience and wisdom about the healthcare system. The second is advocacy for impact. So where we are advocating on behalf of the community, we want to make sure that we have an impact of some kind. And Tony mentioned there are a range of things that CHF has been involved with over the years where we can see we've had a significant impact. Last year, probably one that some of you will be aware of would be our role in supporting the change to 60-day dispensing for some medications, allowing people to get 2 months' supply of their medications, and at some times also at less of a cost. And the third relates to the organisation itself, which is that we are an adaptable and viable organisation. So all of our work really comes across those 3 different streams. And to do that, there are a number of different activities that we undertake. So I mentioned advocacy. We advocate on behalf of consumers on a wide range of health issues, including the quality of services, health equity, and the availability of health information. We generally advocate on national issues, and we tend to choose those issues where there isn't a loud peak body already, leading the charge. So, for example, there are lots of peak bodies in the mental health space who talk about the mental health needs of the community. We do talk about that, but it's not one of the areas we talk a lot about because we know there are other people who are advocating strongly for the needs of Australians. We also do a lot of work engaging with the policymakers. So we collaborate with government bodies, health service providers, and other stakeholders. We participate in a lot of national committees and advisory groups, and have the opportunity to talk to our colleagues in the Department of Health about what we are hearing from Australian health consumers. So we take to them evidence, which might be stories people have told us. It could be surveys we've undertaken. It could be often where we can bringing people with lived experience into the rooms with the policymakers so they can also understand what's happening. We do some research and policy development. So we have policy officers that work with us, and their role is to look at current policies and then take those policies to consumers and ask them if these policies are meeting their current needs. That policy work is often used then when we're making submissions. So we regularly make submissions to government and other inquiries. Just this week, we've been finalising one that the Senate has on the use of generative AI in health. And using the information we have already, we're talking about what we think needs to happen so that generative AI is used safely and provides good quality care for Australians. Recently, we gave evidence at a Senate inquiry into the need for a Royal Commission into COVID-19 and the national response to that. So the policy officers work with health consumers. They also are very busy often writing all kinds of documents to support our policy positions. Our website is large with lots of information on it. I think an average website is about a couple of 100 pages, and ours is over 3,000. So there's a lot of information on our website, previous consultations with the community and the like. And it's a great resource that people use. We also sometimes publish other things either through social media or in other traditional methods to support people in their healthcare needs and improve their health literacy. And we work with our members and other key stakeholders in a partnership way. I mean, Health Journey people engage with health services, clinicians, funding bodies. So we try to work with those bodies, particularly again at a national level, in order to shape and ideally improve the experience people have when they're receiving care. At the moment, we have several main contracts. So we work primarily by receiving funding from the Commonwealth Government or sometimes other organisations. to undertake project work. As Tony mentioned, we have funding under a stream called Health Peak Advisory Body funding. This funding is really funding that allows us to do that work in policy, to write those submissions I mentioned. We also run a lot of webinars and provide other opportunities for consumers to come together to discuss key issues. So that funding allows us to do that work. We have a contract with the government that we received at last budget on supporting the work of the strengthening Medicare reform that's occurring in the Department of Health. So this takes a number of forms. We are in the final stages preparation of a national consumer sentiment survey. We have conducted these surveys in the past, and the intention is we'll do that again this year, and then every year for the next few years through that funding, which will provide consumers with an opportunity to say what satisfaction they have with the current health system across Australia, and also give policymakers and others some evidence that they can use in order to base their policy deliberations. That funding also provides us with money to work with the department and inside the Department of Health itself, and we're doing a range of different activities to help build the capacity of the department to better engage with consumers. And we have our first large engagement with them at the end of this month. We'll be talking to a lot of departmental team members about consumer engagement, what it is and how to do it well. And another part of this funding is us working with particular teams in the department at a branch level who are undertaking one of the many initiatives that sit under the Strengthening Medicare Task Force funding. There are dozens of activities that are funded through this money. And so in the last 6 months or so, we've looked at half a dozen different topics where the government has wanted advice from health consumers to help them understand the best way to implement this policy. Sometimes the way that we do that is through what we call a roundtable, which may well be virtual. We'll have an EOI process, consumers will apply, we'll get a diversity of people in a room, we'll ask them questions, we'll provide them with information. Sometimes we do that by surveys, sometimes we do it in both, sometimes we also add in a webinar which might be educational so that people know what the policy situation is before they come into a kind of focus group or a roundtable discussion. So we do that in a variety of different ways. We also have funding under a grant funding that's called the Quality Use of Diagnostics, Therapeutics and Pathology. So this replaces the work that used to be done by the National Prescribing Service, if some of you are familiar with its work. Here we have a couple of very small grants which we're using to develop some resources to support both consumers and clinicians in medicines literacy. And the final contract we have is one with the Australian Digital Health Agency to support their work and ensure that they get consumer feedback in relation to digital health changes. So they're the key pieces of work that we've got underway at the moment. And we, as I said, we work with consumers, our members, stakeholders, the department, politicians, the media and more. So that does keep us pretty busy. We do have a lot of stakeholders that like to meet with us and likewise work with consumers themselves to really understand what the community wants their tax dollar to do in relation to the healthcare system. Thanks, Tony.
Thanks, Elizabeth. I think Elizabeth was quite humble in her overview of what's going on at the moment. People may recall that CHF received $10.5 million over 4 years in the last federal budget, and Elizabeth has mentioned the projects that that funding is attached to. But as you would appreciate, in order to bring on board the skills and experience to manage those projects has been a huge logistical exercise and continues to be, trying to attract the right staff to undertake and add value to those projects. I mean, it's a challenge, but it's a good place to be in that we have received that level of funding. and we remain hopeful that we'll get some additional funding in the impending federal budget next week, and we outlined a number of key priorities in our budget submission, which people may have seen on our website. So we continue to be very busy and continue, hopefully, to add value to the journey of health consumers in our country. I know that there's a number of questions there, and Elizabeth has agreed to look at those and group them if necessary, and outline and pull out a few that we can address. We've got some good time to do that.
So, Tony, there were a few questions beginning asking about the skills that the board was looking for. That was covered off largely in Joe's presentation. So I'm thinking, I know, Melissa, thank you for putting in the chat that your questions had been answered. I'm thinking those have been broadly answered, but there was a question specifically about younger people, and we could probably make that more general. But the question was, how can people apply if they don't have the core skills and requirements? Joe, would you like to speak to that?
Yeah, sure. I mean, I think we're a very flexible board in terms of using our discretion around appointments in particular. I think we're very keen, as Tony said, to focus on renewal and especially diversity in that renewal. I think people need to think through their capacity to make time commitments and the like. But if you feel that for whatever reason there might be some gaps in your own skills or experience at this point, just talk about that plainly in your application. Talk about your willingness to be mentored perhaps by one of the experienced directors or someone else through our networks, and talk about your vision and your reasons for wanting to get experience by joining a board such as ours. Yeah. We have a very experienced set of directors around that table at the moment, and all of them, I think, are very committed to trying to support and mentor new people coming forward.
Yeah, good.
Thanks, Joe. Tony, I've got a question for you. Someone was just wanting to understand the relationship between CHF and the state-based consumer peaks. Could you explain that, how that works and how we work with them?
Yeah, sure. Thanks, Elizabeth. We aren't a federated body, so we're independent from each other, and as I think we've outlined in our various presentations, we take a national perspective on health policy and program service delivery, etc. The state peaks, as you would expect, tend to focus on state health-related issues, but we are working very closely with the state peaks to ensure that we do collaborate on those matters where there is connection across state and national issues. We're doing that more and more, and that's really a solid piece of work that we really committed to as a board, to ensure that we continue good positive relationships with the state peaks. We have a situation where two states, South Australia and Victoria, don't have representation from state peaks through ceasing of funding. There is some work happening in South Australia where that might be turned around. We're concerned about that, and we've actually offered our assistance wherever we can to ensure that there is a consumer voice in each jurisdiction. Yeah, that's basically how we work. We don't profess to take over the role of state peaks. We clearly defined about what our role is and what the state peaks' roles are.
Thanks, Tony. And I would add that we advocate nationally to the federal government of the importance of having state peak bodies. I know, Shime, you've asked a question about, how can we help we, as Tony said, we work with our colleagues. We also then, when we have the opportunity nationally, encourage the federal government to think about the importance of having representation in each state, and any mechanisms they might have, like, for example, the National Health Reform Agreement and others, where they might encourage jurisdictions to consider consumer peak bodies being an essential part of the health ecosystem.
Indeed.
We've got a question. I'm going to ask this one to you, Joe, because you've been doing the questions, particularly around being able to apply. There's a question from David Evans. Hey, David, lovely to see you here. He's just asking if retired clinicians who are still active in various places are able to be considered for directorships.
Oh, right. Okay, good question. And hi, David. Wow. Well, we don't want anyone to go out to pasture just yet. We need all hands on deck. So, so listen, again, I encourage people to apply, because I think, like any of us around any board table, there's always a conflict of interest that needs to be managed. I don't think that should rule people out of being considered to be eligible for the board of CHF. I think there's ways of managing a whole range of perceived or implied conflicts, and just put it out there what your memberships are, and that in your CV and your application, and we'll go from there. There is so much we've all got to do, right? We need people, and human resources are our most valuable resource at the moment.
Thanks, Joe. Now I'm going to go back to you, Tony. Leanne, hey, Leanne. Love to see you here too, is asked a question about strategic plan. I mentioned the 3 goals, but her question in part was what's the vision, or what is the board aiming for? What are we hoping to achieve next? And I thought you might like to talk a little about your vision for the organisation over the next year or 2.
Yeah. Well, obviously, as we've outlined already, we want a very strong consumer voice in every aspect of health, and when whatever we can do to encourage that, facilitate that through whatever means, that's what we want. We have a role in identifying people who have the skills, the experience, the lived experience to make good contributions in whatever forums, committees, etc. And we continue to build that pool of skills and experience. We want to ensure that consumer participation and engagement becomes embedded in organisation decision making through co-design. It's a huge piece of work, and we can only do that by ensuring that we are a credible and respected organisation, and through that, then we can ensure that good people are picked up and invited in to provide their skills and experience in making good decisions that will impact on the outcomes of health issues for all Australians.
Thanks, Tony. Now I've got one for you, Joe. It's like tennis, backwards and forwards. So yours is about voting members. Someone's asked a question about how many voting members we have, and do they pay an annual subscription? How does that work if you're a voting member?
Yeah, so again, our blessed constitution is fairly methodical about how membership subscription fees are set out and applied. We have currently between 31 to 35 voting members. That's a bit fluid because at any given point in time, there's a sort of an overlap of renewals that might see a lapse in numbers. We do a real push, as you could imagine, prior to the AGM to make sure all our voting members are paid up with their fees, because that's also a requirement under the Constitution before we're allowed to let them be part of the voting process in the election. The membership fees have been looked at a few times over the last couple of decades. there's been, as most people will be aware, a real stretch on community-based organisations around funding and resourcing, and there's been impacts, obviously, to a lot of our members over the years in terms of capacity to pay for additional memberships and subscriptions and the like. The board has discretion at any point as well to try and help facilitate that within the frame of the Constitution. So 31 to 35 is the current voting membership tally. We are looking at trying to refresh a membership engagement strategy. At the moment, we're very keen to build our voting membership base as long as they meet the requirements within the Constitution and the spirit and mission of this organisation. And we do whatever we can to facilitate that. If expenditure alone is some sort of challenge, you just need to let us know.
Thanks, Jo. A question for you now, Tony. Julie, hey Julie, lovely to have you here, has asked what do we consider the biggest risks facing CHF at the moment?
Well, I guess funding's always front of mind, and we're in a decent position now, but we and more often than not, though, some of that funding is tied to particular projects that government wants to see us be involved with. It would be good to have some more discretionary funding to really fulfil what we see as our brief. I guess we need to be constantly vigilant about competition. We don't operate in a level playing field. We don't have the same power as some other organisations do operating in the health sector. So we have to work really hard to ensure that our voice is authoritative and credible, and carries as much weight as some of the other people who have some of the other organisations that obviously have particular views about where health funding and policy should go. They'd be the major ones, I think.
Thanks, Tony. We're nearly out of time, but we've still got time for one or two more questions, Jo. I'm going to come to you. You talked a little bit about conflict of interest in your presentation, and someone's asked a question about that, saying managing interest is always important, and many of us wear multiple hats. So CHF is funded by government, but potential board members might also have board roles in government or with other funders. How do we manage this on the CHF side? Does it become difficult for us?
Yeah, no, good question. And I think in the whole of the health sector, it's really important, first up, that there's transparency. I think with all the multiple hats that people have around the different roles they play, either in volunteer capacity or in paid professional work, declare is my answer. Once that's declared, then I think there can be a really efficient way of organising where people should be able to contribute still, but perhaps not vote, or whether or not you'd actually exclude them from the discussion in a particular area of where they're pretty actively involved and would be perceived to have too many conflicts to easily manage. I mean, a board of governance is incredibly important. As I said before, it's really about trust in the board to manage the affairs of the organisation and put CHF first. So on that basis, if there was ever any director that the rest of the board felt was not going to be able to, show that allegiance and be perceived to show that allegiance by others, then it's better for everyone concerned if they're not involved in that discussion, let alone any of the actual decision making.
Thanks, Jo. Now we need a pep talk for Shiva from you, Tony. Shiva says they came a little late, but so they'd like to join the board without applying for a director role because director sounds terribly majestic. So I figure as the chair of the board, you definitely have the crown on, and you might like to encourage Shiva to understand that perhaps it's not quite as majestic as it sounds. Thank you.
No, it's bloody hard work, okay? But it's fun. As Joe said earlier, it's a privilege to be on the board of this organisation. It's a very important organisation. It does very important work, and it has an important role to ensure that the health consumer voice is at the forefront of development and implementation of health policy and programs. We work assiduously to do that. We make sure that we don't become sort of one-trick ponies, that we sort of roll out media statements being critical, overly critical, without having suggestions about how things could be improved, and what we might be able to do to assist government in doing various things. We really, in order to retain, it's so hard to build credibility and a good reputation. It's so easy to scrap it. You can do it so quickly, and then it's so hard to get it back again. So in the time that I've been involved with CHF, that's really been, I suppose, the foundation of my involvement is to ensure that we do retain that credibility, that we enhance our reputation by being informed, articulate, credible, offering solutions, and not just being rat bags.
I'm quite partial to the occasion rat bag, I have to say, Tony, but I take your point. We're nearly out of time, folks, so I'm just going to mention something. Then I'm going to come first to you, Joe, and then to Tony for any final words before we formally close. So just a reminder that all the information about how it applies on our website. There's a position description. Everything's there to explain what you would need to do. We'll also send this recording out to you, but it will also be on that in that area. We also have a recording from last year's webinar where Tony and others spoke about the board, and we'll pop that up there too, so that if you really want to get a bit of a sense about the board, you can have a look at both webinars as many times as you like. So I encourage you to familiarise yourself, and Tony and Joe have both made themselves available. If anyone wants to have a conversation or something like that, you can let us know, or if you know their details, go to them directly. They're really happy to talk to you about any other questions you might have about being on the CHF board. So we've answered all of the questions in the Q&A currently, and so there's nothing we haven't covered off today. What I'd like to do now is give Joe an opportunity to have some last comments, and then Tony before he thanks everyone and formally closes the meeting. So first to you, thanks, Joe.
Thanks, Elizabeth. And just picking up on that last question, look, there's nothing majestic about any of us. I mean, look at us, for God's sake. We're pretty rough and ready. But can I say this? The cause is what's majestic, right? I mean, nearly everyone involved in CHF at the director level from year one to now has put in the time and the effort to keep this organisation going, to work with the staff over the years, to work with the members and the volunteers elsewhere, to live and breathe what is the spirit and the mission of the Consumers Health Forum of Australia. We need more people because in setting term limits, the board of directors wanted to ensure equity, diversity and access for everyone to participate in this work. It's a majestic cause, so roll up your sleeves and get involved because we need more people.
Thanks so much, Joe. I don't think I can add any more to what you just said. Absolutely spot on, and I hope this evening has whetted your appetite to pick up your pen or your computer, and as we've said, happy to to speak and answer any questions you may have, any unresolved questions, any issues that you want to discuss. Happy to do that. And I'd just like to thank you for taking the time out of your evening, and just like to say thanks very much and good night, and talk soon. Thank you. Bye-bye.
Thanks. Bye, everyone.
Bye-bye.